Okie dokie, thanks. So, good morning, everybody. I'm just going to do a brief intro because you really want to hear from Abby, not me. And Abby can introduce herself after I tee her up here. Um, for those of you that have not been on the grant making committee, the work that the foundation started in 2017 was we were already investing in with two partners that were working in trauma, and that was child parent psychotherapy and ACERT, Adverse Childhood Experiences Response Team. And then in 2018, we started doing directed grant making. And so what Abby is going to do today is she is going to go over the history of the foundation's work, the work over the years, and the different roles the foundation has played from 2018 to 2025, and the impact the work the funded partners have done with the foundation's investment. And so we have been in this work for a long time. Our funded partners have done great work, and we have made, I believe, the foundation has allowed the funded partners to make an impact in the state of New Hampshire. So I'm going to turn this over to Abby. She's got some great information. And Abby, maybe you can also let the committee know if you want them to ask questions during, or if you would prefer to do it after you've done a section of your presentation, whatever works better for you. So I'll turn it over
Great.
to Abby.
Thanks, Gail.
You're welcome.
Before I get started, I have a bunch of disclaimers or comments. One is I have a habit of saying we when I'm talking about the foundation, what the foundation did, because I've been involved for so long. I recognize that it's the foundation's work and not my work. But I do have a habit of saying we, and I mean the foundation. Also, I know that the foundation has moved to referring to groups that receive funding as partners. In this presentation, I refer to them as grantees or places that the foundation has made an investment because those grantees have partners, and partners of partners gets a little can get a little confusing. I'm going to stop at the end of each section and ask if you have questions. I can't see you and see my presentation at the same time, so I've asked Alicia to help manage the chat box and also help me keep time. So here we go. I am Abby Atkins. I'm a managing director in the Research and Evaluation Cluster at Health Resources in Action. For those of you who are unfamiliar with HRiA, it's a nonprofit public health consulting group. We've been providing research, evaluation, and planning services for the foundation on and off for over 15 years. Beginning in 2018, we began working with the foundation to support and evaluate the strategic grant making focused on childhood trauma. Today, as Gail mentioned, I'm here to share with you some of the information about the strategic grant making initiative. Beginning in 2017, the Foundation Strategic Planning Task Force focused on childhood trauma and coverage. The bucket of work prior to this was referred to as trauma and neglect, and the foundation provided funding under that title focus area. There was some research done, and they reflected on the data that was related to adverse childhood experiences. They were also, as Gail noted, the foundation was already investing in some prior relationships with ACERT and child and parent psychotherapy. So they had the opportunity to leverage prior and existing relationships, and they looked at implementing a strategic grant-making process. They began to incorporate trust-based philanthropy principles and ended up investing from 2018 through 2026 almost $2.5 million to implement and support policy systems and environmental change efforts in New Hampshire in this area, plus unmeasured staff time in convening, advocating, capacity building, and thought partnership efforts. The research that was used identified 3 broad areas for efforts to be made. Preventing the risk of ACEs by enhancing home visiting services, increasing participation in home visiting, and reducing unintended pregnancy. Increasing early interventions for ACEs by increasing the mental health workforce capacity, improving community response to ACEs, and improving community-based referrals to ACEs, and increasing health coverage and enrollment, improving parity for ACEs by achieving parity for mental health services for children and assuring enrollment for children with ACEs. By 2020, the foundation had a better sense of readiness of potential partners or grantees to do this work, the needs of the system and roles of the foundation could have. We knew that the work needed to be done in relationship building and convening. Some examples of this work were really reaching out to and building relationship with other funders, potential grantees, and other advocates in this space. There was research that needed to be done to inform the work, such as data collection around communities that were using a home visiting model, assessing the capacity of parts of the system to provide LARC, long-acting reversible contraceptive, and preparing and disseminating case studies related to a case study related to Manchester ACERT, as well as investing or supporting in PSE change efforts. The foundation took a moment to think about, we're more than a funder here, and we thought through those roles. So there was a role for the foundation to be a capacity builder, to be a convener, to be a catalyst, to be an advocate, and to be a knowledge and thought partner. By 2021, we had transitioned from looking at thinking about it in just these 3 buckets of work, to really saying we are looking at systems change work to move towards trauma-informed communities where families, service providers, and community leaders work together to address the impact of trauma and toxic stress. And in these 5 areas, prevention and early detection, community collaboration, trauma-informed services, access to services for parent and children, and informed decision and policy makers. From 2021 to 2025, with a much stronger understanding of how the system works, where some successes were, the work grew into this is roughly what the logic model looked like by the time we got to 2025. We are looking at medium-term outcomes that relate to what we call the donut model, the one I just showed you that looks like a donut, through looking at workforce capacity efforts, community capacity efforts, and policy and advocacy efforts. For the rest of this discussion, I'm going to focus on the work that was done by sorting it into those three buckets: workforce capacity, community capacity, and policy and advocacy. Are there any questions about how you got to this point? Okay. So when we move into this section where we're talking about impact, I want to recognize that almost 2.5 million is a lot of money, and there's a lot of impact that happened here. But it was also partnered with, in some cases, there's direct impact because of the foundation's work. In other cases, the foundation may have leveraged dollars or informed other work that led to some of the successes here. In the workforce capacity space, the activities of the foundation included funding, convening, being a catalyst for change, and being an advocate. The activities in this bucket of work focused on strengthening prevention, early detection, cross-sector coordinated activities and interventions, and improving trauma-informed services. There are four areas of sets of activities here: an early childhood and family mental health workforce assessment, CPP, the early childhood and family mental health credential in New Hampshire, and trauma informed care, or the pediatric improvement process, which folks who've been on this committee for a while would recognize as frequently referred to as UNH's work. The early childhood and family mental health workforce assessment was originally conducted in 2019, and it was co-sponsored by the Foundation and the Endowment for Health to assess to assess the workforce in this space. The key findings included a fragmented system, limited workforce capacity, low recognition around credentials, and structural barriers to access. In early 2020, the foundation hosted a convening of participants in the assessment, leaders within the system, statewide advocates to discuss findings and consider the use of findings in their own work. And these findings were used to inform other spaces and were influential in passing state legislation related to ACEs that we're going to talk about later in this presentation. In 2025, the foundation asked for a brief follow-up to the 2019 assessment, and in that follow-up assessment, the findings included a growth in the early childhood and family mental health system, improved workforce capacity, persistent low recognition of credentials, strengthened cross-sector collaboration, continued structural barriers to access, and the need for a stronger focus on upstream support. For folks who are looking at this and wondering where these assessments are, there's a copy of the original assessment, should be available through the foundation, and soon you will have access to the 2025 assessment. I just need to fix some typos in it, and it should be ready to be released. In the child and parent psychotherapy space, or CPP, for those unfamiliar with CPP, it's an evidence-based therapeutic approach aimed at children aged birth through 5 years who've experienced trauma or significant stress. It focuses on strengthening the emotional bond between the child and their caregiver, addressing the impact of trauma on the child's development, and promoting healthy emotional and behavioral growth. From 2019 to 2025, the number of agencies with at least one CPP rostered provider increased from 11 to 40. And as of earlier this week, there are 250 rostered CPP providers in New Hampshire. This growth has been facilitated by state-backed support, including the ability to pay providers for participating in training and paying supervisors to provide the required supervision component to become CPP rostered. It addresses a challenge that emerged from the 2019 workforce assessment, as many providers named the loss of income as a key barrier to pursuing additional training. The Center for Trauma Responsive Practice, which has been supported by the foundation, that change was also able to provide continuing education units required for providers to maintain their status and covers the costs associated with an agency offering CPP, such as purchasing toys that are utilized during sessions. In addition to increasing the availability of CPP across New Hampshire, there have been efforts to increase referral pathways to these providers. The Center for Trauma Responsive Practice Change is leading this effort and working with the early childhood and family mental health system to increase awareness of the needs and the available resources. The Early Childhood and Family Mental Health Credential is a training and credentialing program overseen by the New Hampshire Association for Infant Mental Health. This credential is open to early childhood professionals who across fields and systems, and is available at 4 levels: foundational, intermediate, advanced, and a reflective practice consultant. The foundational level credential was introduced as an additional pathway since the 2019 to 2020 assessment. The goal of adding this entry-level pathway was to expand the reach of the credential beyond traditional mental health roles, so for example, including childcare providers. Through a partnership with the University of New Hampshire, recipients of the foundational level credential were able to have the credential count towards some credit towards their bachelor's degree, which interviewees in the assessment described as a positive partnership and opportunity. However, at the time that we collected data in 2025, the program had been stalled because of funding in the state budget didn't come through. The Trauma-Informed Care and Pediatric Improvement Program, UNHPIP, received funding from the foundation with two goals of the project. One, to increase pediatric general practice knowledge and trauma-informed care and existing tools to support addressing trauma in primary care settings, and to support pediatric primary care clinics in using quality improvement principles to pilot processes to detect and respond to patients experiencing toxic stress. UNHPIP staff provided training to pediatric practices on trauma-informed care practices, and then provided support and technical assistance over a 12-month period. These activities included supporting practices to implement workflow and screening, and responding to ACEs during office visits. You can see here the groups that were involved in that training. Additionally, they implemented a training and technical assistance model and launched an on-demand training videos focused on trauma-informed care. And you can see folks who participated in those asynchronous trainings on the right-hand side. Are there any questions, or do folks have comments on their own experience with these programs that were in the workforce capacity? Okay. Moving on to community capacity. The foundation's activities here involved funding, capacity building, being a thought partner, and being a catalyst for change. These activities focused on increasing access to service and improving community collaboration. Activities included ACERT, again, the Adverse Childhood Experiences Response Team, and the ACERT TA Center. The foundation provided funding to ACERT, a case study piece, planning and support for other ACERTs, and capacity building support through training and convening. The Trauma Responsive Communities Initiative, and access to contraceptive services. The ACERT model brings together local police departments, social service providers, and community organizations to support children who have been present at police calls by connecting them with and their families with services and resources in their communities. This model originated with a partnership with the Manchester, New Hampshire Police Department and Amoskeag Health Center. The foundation has played a key role in supporting the development and growth of ACERT by providing funding and support for the Manchester pilot and the ACERT Technical Assistance Center. Since its inception in 2015, the ACERT model has been duplicated across communities in New Hampshire, supported by the ACERT Technical Assistance Center, which is also housed at Amoskeag Health. As of 2025, there were 12 active ACERTs in New Hampshire, serving 19 communities. Individual ACERT programs have grown and expanded as they implemented the model. Folks who participated in the follow-up assessment that we did described ACERT as being able to bring, for those who had ACERTs, the ACERT model allowed them to bring in new staff and new partners, and also allowed them to expand the reach of their ACERT. In some cases, this included bringing on new towns under the umbrella of their ACERT. The main factor supporting the growth was identified as sustained funding sources for ACERT. In some cases, this has included the cost of ACERT being absorbed into municipal budgets, or identifying long-term grant funding. Strengthening the relationship with community partners, particularly with police departments, were described as key factors to the growth and evolution of individual ACERT programs. One challenge is actually sustaining funds from the Department of Justice administered through the state that supported the original implementation ACERTs. has existed, but sustained funding for ACERTs continues to be a long-term challenge. From 2023 to 2025, the foundation had a trauma responsive communities initiative. It just wrapped up in December. That was part of this strategic grant making initiative. It focused on having community-based organizations aim to put together proposals and strategies, proposals and then implementing strategies that addressed one or more of the 5 components of the trauma responsive community, so the outside of the donut. 4 New Hampshire community-based organizations were awarded 3-year grants to advance policy systems and environmental change strategies. This work was focused in Coos County, the city of Concord, the city of Nashua, and the Monadnock region. In addition to funding, the foundation led in convenings and capacity building opportunities with grantees throughout the 3-year period. Each community implemented a strategy based on local needs. Concord strengthened cross-sector care collaborations through implementing a screening protocol with New Hampshire's 211 and developing a community of practice. Coos County expanded the Raising Strong Families model, coordinating services for families who are experiencing complex challenges. Monadnock focused on building a cross-sector coalition and delivering trauma-informed training. Then Nashua elevated parent leadership through the Nashua Family Network and mutual aid efforts. Partnership and collaboration emerged as central to the success of all 4 trauma responsive communities initiatives. Grantees built out networks across social services, healthcare, education, government, and community organizations, strengthening coordination to advance PSC change. Across the grant period, communities also conducted more than 80 awareness-raising activities, reaching over 3,000 people. Collectively, these initiatives strengthened partnerships, increased community awareness, and advanced local systems change to support trauma-responsive communities across New Hampshire. Case studies related to each one of these sites will be available later this spring. And finally, in this bucket, we have access to contraceptive services. As you may recall from the beginning of this presentation, one component of the prevention strategy was to reduce unintended pregnancy by increasing awareness and availability of all contraceptive methods so that people were empowered to confidently decide if and when they want to parent. The foundation was joined in this work by another funding partner, You Have Our Trust, who also has related strategies. To inform the development of this work, the 2 funders supported an assessment of the current landscape of sexual and reproductive health services, particularly access to birth control methods in New Hampshire. HRiA conducted that assessment with 2 overarching objectives: to understand the current landscape of access to and education about contraceptive methods in New Hampshire, and to examine the barriers that individual patients face in accessing contraceptives and other sexual and reproductive health care. The sexual and reproductive health care services in New Hampshire were impacted by a New Hampshire Executive Council decision to reject family planning contracts for 3 sexual and reproductive health providers across the state. According to the Planned Parenthood New Hampshire Action Fund, the 3 providers that were defunded provided care to approximately 80% of patients that received reproductive health care covered by the State Family Planning Fund. In this shifting environment, the foundation decided to support Lovering Health Center with a $20,000 operating grant. Located in Greenland, New Hampshire, Lovering is dedicated to providing confidential, comprehensive, and accurate sexual and reproductive health information and services in a supportive environment. With this operating support, Lovering staff was able to provide access to education and LARC, long-acting reversible contraception, for 164 individuals. Approximately 86% of them were low-income individuals. Any questions about this bucket of work, the community collaboration capacity bucket of work? Okay. Finally, we have policy and advocacy. The foundation's work in this space included funding, convening, being a catalyst for change, and being a thought partner. Activities were aimed to have more informed decision and policymakers. This next slide, I'm warning you now, has lots of big money on it, and this is about the state level investment. These are not the investments of the foundation. The foundation has been providing 3-year grants to since 2015 to New Futures. New Futures works with policy change and civic empowerment, and their work has supported or led to state level policy change related to early childhood issues. The early childhood and family mental health workforce assessment and the work of New Futures has influenced some of the state legislation. The first piece of state legislation was passed in 2022, Senate Bill 444, ACEs treatment and prevention pilot that provided $2.75 million to support ACEs treatment and prevention. In 2025, another bill was passed for the appropriation of New Hampshire DHHS to establish an ACEs prevention treatment program. And again in 2025, the early childhood mental health credential received some funding. The work of the foundation as being part of a funder collaborative and influencing this is the last piece here. This one statement, regular contact with members of shared interests, does not do justice to the amount of work that has gone into being part of a partnership that focuses on childhood funding that may be beyond the scope of what the foundation's priorities are, but it is this collaborative work that has led to maybe partnering for funding in smaller initiatives, but also thinking about the advocacy space. Gail, do you want to add anything else about the Funder Collaborative?
Yes, thanks. So the Funder Collaborative started with the Endowment for Health, You Have Our Trust, and the New Hampshire Children's Health Foundation. And then I belong to the New Hampshire Funders Forum. And it was suggested that organizations that participate in the Funders Forum might be interested in participating in the Early Childhood Funder Collaborative. So it has expanded from 3 funders to, I think there's 10 or 12 now from around the state that participate in this. Elisa and I are participating. They meet like every other month, and we sit at the table. Right now, they're focusing on early childhood education and child care predominantly. We have not and do not fund in that, but we really feel it's very important for the New Hampshire Children's Health Foundation to be at the table. So we will continue to participate, probably even when we move into the different work that we will probably be doing come the fall after our board retreat. Having said that, the board may decide that early child care may be something we might be interested or not, but we still feel that we should be at the table. There is a small membership fee that we pay to belong to that, but it's really worth our while to be at the table with all these other funders that are working in early childhood matters.
Anna has a question.
Just really quick question. Is the Couch Family Foundation part of this early childhood funder group?
Yes.
Okay.
Yes. And they are, the driver is too strong, but they are the driver of this early childhood education and childcare work.
I suspected. Okay. Thank you.
And I meet regularly with the Endowment for Health, the New Hampshire Charitable Foundation, the Couch Family Foundation, and I meet probably every 3 months.
Yeah. Thank you.
Welcome.
So when all is said and done, what did we get out of this? When thinking about the current state, there's definitely been a growth in resources for positive childhood experiences. There's been an increase in collaboration of community-based organizations, schools, and health systems to be trauma responsive. Statewide policy and resources are there to support and strengthen systems. Changes in federal policy and funding levels will continue to impact these systems, and definitely the expectations around philanthropy have increased. When thinking about a strategic grant making process, what did we learn? Well, we learned that multiple roles for the foundation can impact change. So it's not just about the foundation cutting checks to have work done in the community. Success requires a higher level of staff engagement with current and potential partners. There was a lot of work done to instead of saying, oh, we think this is a good strategy and just giving an entity money to address that strategy, looking at community readiness, checking your own lens and opinions on what you think should happen, and working with organizations and building relationships to figure out whether or not that's actually appropriate or not, or whether or not that could happen. That policy systems and environmental change strategies actually have longer term sustainability in their change, and that multi-year focused funding allows for deeper impact. When it comes to PSE work, that doesn't happen quickly, and there needs to be multiple years worth of funding to support those changes.
Abby, can you hold the slide for 1 second and may make a
Yep.
comment, please? Grant making committee, if you look at these 4 bullets and you think about the time that the foundation has been involved in this work, so 2017 is when we started talking about it, 2018 to today, these 4 bullets exemplify trust-based philanthropy long before we as a foundation were talking and using trust-based philanthropy words. So I think you can feel pretty good about the foundation doing the work of TBP before TBP became the thing. But these 4 examples show the work that the foundation has done.
And I think that this, Gail, all the rest of the slides I have are just bonus slides in case somebody asks questions. So any questions? Pam, Brian, you were involved in this early on. How does this feel with where you started and where
Yeah.
you are now?
We're the trauma 101,
Yeah.
and we were the impatient cohort that wanted to actually start implementing before we were supposed to, and we did. Yeah. But I also think as you get more data about who's joining, some of that might be misleading. Like we could be missing people who are doing it.
Mm-hmm.
Because, like, I mean, I don't think anyone else in Coas County has signed up, but there
Mm-hmm.
are no other primary care things in Coas County left.
Yeah.
Because we're all so connected that everyone has had the training. It's
Mm-hmm.
part of our onboarding now, so there's no chance a new provider here is not going to be expected to do
Mm-hmm.
promise grading,
Mm-hmm.
whatever. I like the word sustain. I like some of your examples of partnership. I mean, just in our clinic, we now have some of our telecounselors who offer services in school. So either for people who don't have internet at home
Mm-hmm.
or they're just not reliable. So, but I mean, and the schools were super on board. They don't care if a kid's missing class. They bring them to some quiet room outside of guidance. I think it's made a big difference that some of these kids who were never in school or always being suspended are now staying. So I think I've seen the success locally, but I think the overview of the kind of the other little arms in the state was great.
Yeah, I kind of feel the same way. I feel like we've been doing it forever and it's kind of a word now that everybody uses. So I think that the realization that ACEs exist, and I don't think I go to a conference where there's not at least one session that talks about trauma-informed practice. So I think that I don't know. I don't know that we were cutting edge in 2018, but we certainly were important to be involved in this work, and it was money worth spent. I would like to see how the trauma-informed communities sustain and some of the implementation that they do when the funding ends.
So we have worked on some case studies for each one of them, so you can see the results of the work that they did. And some of them are the sustainability has to do with the staff who are no longer involved.
And I think I forget what the bill was, but recently there was, I think that part of the general fund for the state went towards some ACEs work. So that again, sort of the scaffolding has been built and will continue through, the state support. I don't know if Susan sees a lot of this in what she does.
I was thinking about your comment about state support. I'm wishing I felt as much faith that it would be there when we come to do the biennium the budget for the biennium next year. Yes, may that be true. I think we're going to have a lot of work cut out for us in the advocacy realm, though. The other thing, I think I wanted to mention when we were talking about the ACER teams, that's a place that we, through our information resource line at New Hampshire, often refer folks. So it's kind of striking to me. I don't know. We don't have good data to look. It's like before the first ACER team stood up, like what that call volume might have been. And this is to our information resource line. This is not like, well, this is what we do. It's just people are like, oh, I have kids who've gone through terrible trauma. I don't know what to do. And I happen to sit on an advisory committee for what's called the Burn SCIP. And please don't ask me what SCIP stands for. It's spelled SCIP funding. That was part of the Bipartisan Safer Communities Act under the Biden administration. And so it's a formula grant to each state expanding on their burn formula grant. And I know that we have, through that advisory committee, made some additional funding available to the Manchester ACER team, for example. But that sustainability remains a real concern. And it's striking to me when you need the ACER team, how badly and quickly you need the ACER team. It's not like we have time, we can figure this out. But I think all the work is just so critically important, and the foundation has clearly been a leader in the state, even if not cutting edge nationwide. And this trauma-informed care work, and certainly then as someone who've never been a recipient of grants from this foundation, but does a lot of work with other foundations, I think moving to trust-based philanthropy, frankly, it increases the return on our investment. We just, grantees can spend a lot of time trying to not just meet the requirement, but anticipate. There's a lot of like, oh yeah, think about this. What would her board think, right? So my 2 cents, Pam.
Anything else? So Abby mentioned 2 reports that we are working on together to just wrap up and put a bow on it. And those will be available to the board and to the general public. We'll be meeting with Brett, who's on this call. Abby, Brett, and I are meeting to figure out about the reports, how we're going to use them, where, when, why, and be putting them out to the public. And so that will be a good next step for us as well. So
Well, it has been a pleasure working with the foundation on this project. My team has really appreciated it. And it's great to see so much collaboration across philanthropy in New Hampshire, in a coordinated effort to have change happen for the communities and the residents of New Hampshire.
Well, thank you very much, Abby. As you noted, that you've been working in partnership with the foundation. You said 15 years. I think it's even longer than that. I mean, HRiA and the H&H Foundation, now the New Hampshire Children's Foundation, have walked hand in hand for a long time on a lot of projects. And Abby has been at the lead of all of these, and she has done a great job. She has a wonderful team that supports her and our foundation, and we've been very grateful for the partnership and the work that we've done together. You folks have done a great job and have made our work easy because
Thank you, Gail.
Because of the support that you have provided and the leadership. I mean, HRiA has great expertise, and their advice and counsel has been meaningful and impactful. So thank you very, very much, Abby.
Oh, it's been fun.
It has been fun.
Yes.
And so are there any other questions? Elisa, do you have anything else that you want us to be doing before we say goodbye?
I do not.
Okay, I did not send out, my bad. I did not send out the January board grant-making committee minutes. So at our next meeting, I will send you the minutes from January and these minutes, and we can vote to approve them. And if there's nothing else, I'll turn it over to you, Elisa, for the sayonara.
So our next meeting is technically the June 10th stakeholder session, where most of you will be listening, but at least one of you will be participating because you were interviewed. So you'd be wearing a different hat that day. And then we have kind of a break, if you will, for grant making for the summer. And then we'll reconvene. And so the expectation is that after June 10th, the meetings moving forward will be continuing the discussion we started in January, which is, what should this committee be doing to support our transition and our next focus of work? What could our name be? What kind of structure and things like that. So that's what I anticipate us working with Pam to set those agendas. And the final meetings of the year will be really focused on launching for 2027.
Great. Well, Abby, thank you. Thank you, everybody on the committee. Elisa, thank you very much. Have a nice rest of the Friday and have a nice weekend. And I've given you 13 minutes